Hey everyone, I'm Dr. Michael Breus, the Sleep Doctor. Welcome to another episode of Wake Up Wednesday. I'm on a mission to help people get the best sleep they can, and I love hearing from you. Every single week, I answer a few of your sleep-related questions, and I gotta admit, there's quite a few. If you have a question that you'd like to see me answer, head on over to thesleepdoctor.com where you can send me an email. While you're there, do me a favor, scroll down to the bottom of the website where you can subscribe to our weekly email that's packed with all of my best sleep tips. Okay, let's take a look at our first question. This comes from Caroline, and she writes, "Sometimes I have a scary, sad, triggering dream that makes my mind race and create negative emotions. I then have trouble falling back to sleep. Is there any way to prevent bad dreams, and how can I recover and get back to sleep quickly?" Well, number one, understandable that you have a lot of dreams. What we find is for people who have a lot of dreams, oftentimes they're thinking about something just before bed that starts to trigger those dreams from an emotional standpoint. So one of my favorite things that somebody can do is create a gratitude list. Creating a gratitude list, you just are writing down and thinking about all the positive things in your life and the things that you are grateful for. There's actually data to suggest that if you have positive emotions before bed, not only does it help you fall asleep more quickly, but it helps you have more positive dreams. So that would be step number one. Now, if you wake up in the middle of the night and you're trying to get back to sleep quickly, one of my favorite methods, and I've used this for quite a few different things, is called 4-7-8 breathing. This is where you breathe in for a count of 4, you hold for a count of 7, and you breathe out for a count of 8. It forces you to concentrate on your breath and counting those seconds, which takes your mind away from the anxiety-provoking dreams. It also lowers your heart rate, and you have to have a heart rate of about 60 or below in order to get into a state of unconsciousness. Next up is a question from Robert. He writes, "What are dreams that occur immediately on falling asleep? Not visual or audio hallucinations known as hypnagogia, but a full-fledged color vivid dream from which I wake 15 to 20 minutes after I sleep onset with good recall." So if I had to guess, I'd have to say that this is probably due to a significant level of sleep deprivation, where your body is kind of trying to catch up on a little bit of REM sleep, and then you fall asleep immediately and have that dream. If you really want to figure it out, what I would suggest doing is maybe getting a tracker and being able to see what's happening. How quickly are you falling asleep and what stages are you in? That might give you a little bit more insight to what's going on. Our next question is from Duncan. Duncan writes, "I have REM sleep behavior disorder, which causes me to fling myself out of bed occasionally, say every 6 months, or more frequently, just thrash about in my dreams. What precautions might I take to ameliorate these effects besides the obvious? Would a sleeping bag be useful? Is medical marijuana helpful? Is hypnosis good for gentler dreams? Other aids, or just putting the bed against the wall and lowering the bed towards the ground?" You've actually hit on a few of the things that we like to do. The first thing is safety first. So when people are pushing themselves out of bed due to REM behavior disorder, and for folks out there who are wondering what this is a situation, not a nightmare, but where you're acting out your dreams. It has a tendency to occur in the last third of the night, whereas nightmares and those type of things have a tendency to occur in the first third of the night. Sleeping bags are definitely one of the things that I have a lot of my REM behavior disorder patients utilize, because as you're kind of mummied up and then you're not going to move around nearly as much. Medical marijuana might actually exacerbate the situation, so I would not necessarily go in that direction. There is some new data, however, that looks at use of melatonin for REM behavior disorder. I would talk to your doctor about that before you try it yourself, but that might be a helpful hint for something like that. I've never seen hypnosis used to get people gentler dreams when we're talking about REM behavior disorder, as this is a brain disorder, not necessarily something that has the largest psychological or hypnotic component. But I do like the idea of putting your bed against the wall and lowering your bed so that way you don't fall out of bed and you don't get hurt. Thanks so much for all of your questions. Remember, if you've got a question you'd like to see me answer, visit thesleepdoctor.com/sleep-questions. Also, be sure to subscribe to my weekly newsletter as well as my YouTube channel, where I'll be giving you the most current and relevant answers to your burning sleep questions. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.